Sure, if you've joined us yet.
I know Kevin Hart is here. Let me see if I can track down Kevin Harrison.
A reminder, these calls are for our transit systems within North Carolina. They are not for the press. They will be recorded for viewing at a later date and be published on our website at the end of this call. Today's agenda, we will have a guest speaker. We're going to do an update on the CARES Act implementation. Following that, we will talk about some ROPES map updates and guidance. I'll talk briefly about two of our upcoming projects, which are the Mobility for All pilot and the NC Transit Cares, initiative, and then we'll wrap up with some questions. So I just want to move on to our guest speaker today. I'm pleased to have Kevin Harrison from DPI here to talk about partnership opportunities with school transportation. I don't know if you remember this picture, Kevin, but this was 10 years ago when we did Clean School Buses. Kevin's in the far back there in the blue shirt, and then a closer up so if you know what he looks like. So Kevin, I'll turn it over to you.
Certainly. Hope everyone's doing well today. So there's things have changed a lot, and I'm sure everybody's keenly aware of that. So public transit had expressed some interest in knowing how they could sort of join in or what partnership opportunities might be around on the school transportation side, especially during these very unusual times. So today I wanted to talk a little bit about areas where we align, because really public transit and school transportation have a tremendous amount in common. We both utilize regular routing systems, electronic routing systems mostly, to tell us where the vehicles are going, where they are currently, and perhaps where more vehicles are needed. We also utilize drivers that have commercial driver's licenses, and there are a whole host of requirements associated with them. All on the school bus side, there are some reductions in some of the requirements and increases in some of the other requirements. So things are a little different on the school transportation side. And we're both trying to get people from one place to another, of course. And on the school transportation side, we are a little different in that oftentimes we are moving them from very near their home to exactly where they want to be, which is a school. Little different perhaps than public transit's normal operating, because you clearly can't deliver a person necessarily directly to where they need to be in larger vehicles. But we do, because we have large numbers of people coming to one particular place. So I think, though, that there are definitely some times where you are more like us and sometimes when we're more like you, such as McKinney-Vento homeless transportation, in that requirement that students be returned to their home school, for instance, even if they have moved far away. And in some cases, public transit's operations may already be assisting in the transportation of those students. So I just wanted to get to a couple of things where there are some opportunities if you have excess capacity, and if the student transportation operation needs additional assistance, that you may be able to consider assisting. Perhaps the most on point one is any out of the way students for school transportation. So I know that, for example, out on the coast, there is one student that the transportation department is taking a bus and a school bus driver up the island a half hour, not picking up any other students along the way, and then driving back another half hour to get back to essentially where the rest of their people are. So they're devoting an hour of a CDL driver's time to transporting that one student. That's 2 more bus runs full of 12 students that they could make nearer to the school that they're losing because they're having to travel a long distance. So there may be some opportunities there to, if you have some small vehicle transportation available, that you could utilize those small vehicle transportation in consultation with the school district to free up their bigger buses to make short little runs that in more population dense areas. So that's one possibility. You could also consider if you have any capacity to help with unexpected passenger loads. So if they open school and are expecting only a small number of students on a particular route, is there something you can do to pick up additional students or divert a larger vehicle to pick up additional students, say at an apartment complex, somewhere where you're not having to make an on-the-road stop, but something that would offload some of the capacity issues or unexpected loads of students that they might have. Is there funding available for the schools to pay for those services? Perhaps. I mean, right now they're looking at contract transportation and other types of things. So, I mean, that's a discussion worth having with them as to if they have funding available for that purpose. It would sort of as right now, for example, Wake County does a lot of contract transportation with third-party providers already, such as Student Transportation of America. And I know Guilford utilizes First Student to provide actually some school bus-based transportation, and others contract with cab companies, especially when you're talking about small numbers of students that are out of the way. McKinney-Vento, or which is homeless transportation, homeless and foster student transportation, or something along the lines of EC transportation to a school that's not in their area. Wake County does that a lot. So they have a specialized program for autistic students, and they move them around. So don't let me get too deep into the questions at the moment, but so carrying on with that idea, you could also do a little more out of the box, perhaps, electronic routing assistance for any time-sensitive or critical changes to operations. You have staff that are probably familiar with electronic routing and adaptive load balancing, sort of that type of transportation experience. They might not be familiar with the particular product that North Carolina uses, which is a product produced by Edgelog Education Logistics. In almost all counties, and but electronic routing systems are fairly similar. You get the ideas. There's streets, maps, locations of people, and locations to stop at, and so you may be able to adapt to learning that electronic routing system fairly quickly because it's similar to whatever it is you're already using. And then also a possibility to perhaps give your employees the opportunity to be substitute school bus drivers. So along the lines of the substitute school bus driver, I wanted to mention that there are additional requirements, and then there are things that go away. So of course, hours for service requirements, because we're a government entity, and school, both of those things actually. Those hours of service and electronic logging, those things kind of float away. Of course, they still have to maintain that information for your purposes, but not for the school transportation side. They also have to have, in addition to a CDL Class B commercials driver's license, they have to have, and the passenger endorsement, they have to have a school bus endorsement and a school bus driver's certificate. Normally, S endorsements are, well, it could be that you've gotten an S endorsement from another state and transferred into North Carolina. But the most common case is that someone comes to a school district without the S endorsement, in which case in North Carolina, that gets you an S endorsement and a school bus driver's certificate occur at approximately the same time. They have to have all the things you would expect, which is a valid DOT medical card on file with DMV, proof of recent drug screening, and being participating in random drug screenings. Those are normal things. And then they have to attend class, usually one day, to receive instruction on the school bus endorsement portion. And you can also be tested at that same time for the school bus endorsement test. You don't have to go to DMV separately. You can do it all there right after the training. Okay, so school bus endorsement testing and training, that's usually a day. And then, because it's a school bus, you are required to attend behind the wheel training and repass all skills tests in a school bus. So that behind the wheel training, depending on how familiar and you are with the vehicle, I'm given to understand that the pre-trip inspection portion of the skills test is one of the most difficult. Given how familiar you are with that, how long you've been driving a large transit vehicle, you may already have experience. And that is usually a 3-day behind the wheel training, but DMV, which consists of a little more than 2 days of training, followed by a day to come in specifically for testing purposes to pass the skills test. And all of this is done with a specific group of staff from DMV School Bus and Traffic Safety Division. This is not, you don't have to go to a commercial driver's license testing office or any of those things. So you could abbreviate that training, perhaps it could be 1 day where you would do the training and then come back for the skills test. Very possible that that could be accelerated as well. So, and at that point, you can get a school bus driver certificate that has to be signed off on by DMV School Bus and Traffic Safety, as well as a representative of the school system, of the county school system, indicating that they've examined you and believe that you are qualified to operate a school bus in North Carolina. So that's kind of the process. From there, the process will vary because school districts have different requirements. So it could be, there could be human resources considerations and other things that vary more highly because they're not related to state policy or law. But those are the areas which I kind of see a big possible benefit to, especially as school transportation is confronted with things that they have not considered before, which is how do we have always been, how do we get more people on vehicles? How do we get more students on each of these vehicles so we operate efficiently and spend less money transporting each of these students? And we don't have to buy as many pieces of equipment either. So we're telling them to turn that entire thing around and say, start encouraging people to carpool and show up in carpool lines instead of riding the school bus, because we know that there are students that need services, and we're moving from an arena of 72 elementary school students being on that vehicle to 12, potentially. only 12. And that's a huge hit. So even if the school goes to 50% capacity and says that we're only going to have students half each day of the week, we still can't get anywhere near the number of students on the bus that we were doing a few months ago. And that's going to impact everything downstream from that. Traffic around schools is going to explode. If you have a problem right now with traffic around a school, you can go ahead and figure that that's going to go up by maybe 50%, even if they reduce the number of students coming into the school. They will still increase carpool traffic because parents will choose to drive where they're able. So I would just encourage you, if you have the opportunity to work with school transportation in your county, to be open-minded to the ways in which you align and can provide or assist in providing services, especially to the extent that you have people available or your services have been impacted or reduced because of the situation with the disease in your area. So what other things do you want to know or need to know?
I think you've covered it really well, Kevin, and I do appreciate your time. In the chat box, there was a couple questions, and Kai has touched on a lot of or has responded to a lot of the questions. So just going through them real briefly, the question was, is there funding available, which I think you touched on. Would this be considered a charter, which this goes down towards the bottom? What requirements are there to, they've got, basically right now they've got a requirement to not do school bus transportation, and a waiver will be required. And because of the emergency situation, I think we could apply for a waiver. Bonnie goes into the requirements that you also covered as to how to get this licensing. And then there was a question about why we're even talking about this. And I think the crux of that, which Kai did touch on, is that we're all in this together. And when it comes to reopening the economy and getting things back to normal, we need to start thinking outside the box. And we're not saying that we're going to do this, that we are, this is what we're endorsing, but we just want to open up the channels of communication, because I think it's very important for us to think about how we're going to return to normal. And like you said, Kevin, with, bus capacities being reduced drastically, even if the bulk of the parents choose to, carpool, or as Ed Johnson mentioned about encouraging children to walk and bike, obviously where possible, that would be great. I would have loved that for my kids, but there's no way to walk or bike to any of the, schools that my kids were assigned to. So that, exploring all of those opportunities, I think it's going to be important when we try to determine how we're going to get kids back into the schools.
I think you said it very well there, and I think that is, you have to look at the scope of the problem for school transportation, which is that in North Carolina, if you don't live within 1.5 miles of the school, then they are required to provide you a stop, essentially, that is within 1 mile of your home in order to transport you to that school. That is different than other states. It's different than other, well, it's of course, it's just different. I mean, but it also means that schools are going to be restricted by student transportation unless all the parents just decide to drive their kids to school. Many of them can't. Many of them have already left for work. Many of them, I would imagine right now, if you were truthful about it, what you would see is that during this, even during right now, you would see that parents are leaving those second and third graders home, even though they shouldn't, because they have to, because otherwise they won't have a home. So I think there are some, I guess the big thing here is that if there's a way to assist with student transportation and allow them to be able to serve those others in their community more easily by helping, or if your drivers are looking for extra work and they could become substitute bus drivers potentially, some early mornings and late afternoons, that would be very helpful to potentially to a school transportation department that may be struggling to find not so much people to work, but at this point, enough time to train enough people to work, because they can't even, you can't even do behind the wheel training with the same number of people as they were doing before. So we're going to have issues with anybody that takes a long time to get a license.
All right. Again, Kevin, I thank you for your time. I think the last question that we have was responded to by Kai. So we will move on to the next topic. Kevin, you're welcome to join us, but if you've got other pressing needs, I want to be respectful of your time. And again, thank you for joining us today.
Thank you for inviting me.
So we're going to move on to our CARES Act update for today, basically to give you an update on the system application status, and then also talk a little bit about the availability of PPE through FTA. So at this point, we have now received 75 out of the 78 applications that we've submitted. Our group has been busy getting these agreements in place. We now have 22 agreements out, which is great. We've got 49, which is the bulk, that are still in level 2 status, one that has been returned for correction, and I should have updated this with the update this morning. This is actually now 3 that do not have applications in EBSs, excuse me. MDSs will be contacting those 3 remaining systems to find out if there's any issues or what the, why they're not being able to get their applications in, whether it be waiting for board action or other reasons. With the 5307 CARES Act applications, we have 11 at the level 2 approval. 1 has been rejected and 2 additional are in process. FTA has reached out to us to tell us that they are providing some masks for us to distribute to transportation systems. So we are going to send out a survey to all systems asking you to please provide a number of masks that are needed. And by that, I don't mean you need 1,000 masks or what have you, but just give us an indication as to whether you need masks or not, how many employees that you need masks for, so we can determine how to distribute those masks. And that will be through a smart sheet survey sent out to all the 5311 groups. As a reminder, we did request at the end of last month for all systems to return a policy change, which would allow you to retain any unspent SMAP or ROPE payments. At this point, we have received 98 policies returned. 14 policies are still outstanding, but they have requested an extension. And we're just asking you to please make sure that you submit a policy even if you think that you have expended all of your funds, in case documentation when we do the reconciliation at the end of the year does not match. I just want to touch briefly on some exciting news that we got earlier this week or late last week. We have been selected by FTA to receive a Mobility for All grant in the amount of $280,000. It is going to, it's a project in the northeastern part of the state to integrate trip scheduling software to improve access to healthcare. The key partners include the Health Administration of North Carolina, as well as the Intercounty Public Transportation Authority. And there's 5 counties, which I've highlighted here in the map, that are going to be participating in this pilot. The hope is, if this is successful, that we will be able to roll this out to other counties within North Carolina. I just wanted to give another plug for NC Transit Cares. This is the project that we have that's going to be looking at innovations and preparations for returning to normal with respect to COVID-19. There is a survey that should be out here shortly. We're going to ask you to have that survey hopefully completed by June 26th. The meeting is going to be virtual on July 22nd from 10:30 to 1 p.m. And we really do encourage all systems to participate. It's very important for us to get feedback on the impacts of COVID to the systems, and also ideas on innovative strategies that you've either employed or are thinking about employing to help become more resilient to not only COVID, but other disruptions moving forward. And that is it for the content overview. If there are any questions, we will certainly entertain them now, and I will turn it back over to Blair. There is a question I can see right now about for mask needs. Right now, we're asking for the number of employees because the number of masks that we are getting initially is a limited supply. Obviously, we're not going to be able to predict, or we're not asking you to predict how many masks you need, per month or per day or things like that. And so we're going to use the number of employees as a first gauge with respect to the mass dispersal. And let me move this over so I can read it. I'm not familiar with the term RGP match. Tammy, do you know, the question is, do we include the fares used for RGP match on the 5311 CARES Act reimbursement form?
No, you do not use anything related to SMAP or rope. Only fare box revenue. And I think somewhere on our website we actually have the definition of what that is, if you need that help.
And thanks, Blair, for giving me the it spelled out. I appreciate it. Are we required to start our CARES Act reimbursement claims as of 1/20/2020, or can we choose a later date? For instance, 4/1/2020. If so, would we be able to deduct fare box revenue beginning 4/1/2020 also? The answer to that is yes. You can start it at a later date. We don't have to go retroactive. It's, in fact, because of several systems already having submitted and having received reimbursement for claims for that first period of COVID related eligibility, it becomes increasingly complicated on our end to go back. So the answer is yes, you can start at the later date, and if so, you should deduct the fare box revenue starting at the same date. Next question is, the facility projects were approved by the Board of Transportation last week. Can we expect contract agreements on them soon? Tammy, that would be a question for you.
We are going to make sure that the applications are out in the system soon, and you'll get an agreement when we have the applications returned. I'm still trying to hammer down a few specifics with FTA, so we'll get those out just as soon as possible.
And as soon as the applications are out, we will announce that also on a weekly call. Is there a recommended frequency for filing reimbursements on 5311 CARES Act agreements by month, by quarter, etc.? I'll defer to Tammy, but my assumption would be that you would submit however you had previously submitted under 5311, that frequency.
That's right. At the very least, quarterly. If you do a monthly already, then you can continue doing monthly.
Okay. Next question is, when will we be notified of what our allotment will be for fiscal year 21 for the CARES money? In our situation, I would think that the money currently allotted equates to roughly 5 months of service. I am confident we will consume what we are currently allotted. It would seem reasonable that the formula would be the same amount, slightly more than doubled, to accommodate a full 12 months of next fiscal year. I'm not sure if this is exactly the question that's being asked, but we have had this concern raised by other systems as to that first allotment of CARES Act money is the assumption that that should be 1 year of operation. And the answer to that question is no. There was no assumption with respect to how long that money was supposed to carry the systems for. The formula allocation was used for that initial tranche of money just to fairly and easily get initial money out to the systems. We are convening a group right now, a stakeholder group, to try to determine how we should distribute that next tranche of money. If you recall from some of our initial calls, we had said that that second phase of funding would be a needs-based, So that will require an application to be submitted demonstrating additional need. It was recognized that some systems will be impacted more severely by COVID than others. And so it's going to take more time. But just to clarify, we're not assuming that that first allocation of money is going to last you an entire year. It was just our way of getting money out to the systems as quickly as possible without having to go into a lot of thought as to how much to allocate to each system. 5339B applications. The applications and funds have been approved. Tammy?
The application that went in for the grant award for the discretionary grant is not the same as the application information that we need to have on hand for oversight related to giving out the money. So it's, I mean, sorry, but nothing's that easy when you're playing with government money.
The next question is, we had submitted our third quarter 5311 claims at 85% before it was decided that it would be reimbursed at 100%. Will we be credited for that amount? The short answer to that is it's not an easy process to do so. And we want to make sure that we are treating all systems equitably. At this point, we need to determine what systems have submitted at the 85% versus not. And additionally, it also depends on whether the amount that you were reimbursed for was only the federal portion, because returning it to, we can't increase the federal portion. So if you, your reimbursement claim included both the federal 85% plus the 15%, then there's nothing to reimburse you for or refund, because basically it going to 100% for those initial claims from 2020, it reduces the amount because we can't change those federal dollars. So we'll have to look at that. If there's an issue that you have that you want us to consider, then again, you need to contact your MDS so we can do that on a case-by-case basis, because it's not a cut and dry answer. In answer to the question, the first allotment will need to be one lump sum for this year alone if the agreements are just now going out. In other words, if I choose 2/1/20 to the end of this fiscal year, I would file one lump sum instead of the monthly quarterly, since we are 3 weeks away from fiscal year end.
The agreement date actually for the CARES goes out through June 2021.
Yeah, I mean, there's not, the CARES Act funding does not expire, and this initial allocation, as Tammy indicated, has a longer period of performance. It doesn't align directly with our fiscal years. Want to be sure that I understand correctly. If we would like to submit for capital funds with CARES, it would have to be done during the second disbursement. The decision as to what that second allotment of money will cover has not been decided. That is something that we are creating a working group to determine. Our initial thoughts were that capital would not be addressed until the third tranche of money, and that's primarily because we wanted to ensure that all systems had ample money to cover operations. The question is, are you issuing a blanket period of performance for capital grants, or do we need to apply for individual? And that's, I believe, Tammy, you said you were doing a blanket one for capital grants?
Yes, we're actually pulling that together now, and Chris Dodson is checking to make sure the date we need to take it through to cover all the vehicles.
So the question now is, one of the systems has already calculated their full amount to be consumed already. With this in mind, we are planning to submit one claim from 2/1 to 6/30, which will be either all or close to the full amount. I mean, if you've got receipts that can indicate that you have funds to claim for that full amount, then you can submit them. Unfortunately, until we are able to develop the policy and procedures for that second tranche, we're not going to have any additional money to allocate to your system. Although I will say that if you have already think that you have expended your funds of the CARES Act funding, in addition to the funding that you have already received for fiscal year 20, by the end of this year, to please give us a call or an email so that we can look at your system specifically as to what we may need to do. Because we certainly don't want you running out of money. It's just that we don't have the mechanism in place to allocate additional funds of CARES at this point. Would hand sanitizer be listed as cleaning supplies? It would be under supplies. I mean, it certainly is a covered expense. I'm not sure if it breaks it down into that level of specificity. Wherever PPE would be under, that's where I would put it. Tammy, do you have anything you want to add to that?
No, I mean, no. Office supplies,
I mean, it
cleaning.
would,
Yeah.
yeah. Um, Okay, I'm not seeing any additional questions. We'll wait another minute just to make sure nothing else pops up. So there was a clarifying question with respect to hand sanitizer, PPE cleaning, or first aid. Thought it should be one of those according to the claim. So no, it should be office supplies on the van or the drivers. Tammy, I don't know enough about submitting claims. I mean, as long as the invoice is clear, does it matter which category they put it under?
No, we're not going to get that minute.
So I think as long as you've got the documentation of what you're purchasing, just put it under whatever category you think it fits or is most appropriate. Okay, it looks, will Myra approve that? I assume you're asking if it's under any of the above categories. If there's a question, if we need to be consistent about where we put it, we can circle back with Myra and find out which category she would prefer to under, and we will send out a follow-up email to all of the systems to make sure that we're being consistent. So there's a follow-up question. I thought the prior question was, instead of submitting a quarterly claim since it's almost June 30th, can our CARES claim cover February 1st through June 30th or April 1st through June 30th and not submit two claims, one per quarter? This would be a question for you, Tammy. I don't know if there's a policy for submitting claims.
Since CARES is not the typical grant that we have, then yes, you can absolutely go ahead and bill what you've got to cover in the whole up through June 30th. Just please put the spreadsheet with it.
So I think what I'm hearing is we're going to provide as much flexibility with respect to claim submittals under the CARES Act as we can. Okay, I'm not seeing any additional questions. So I first want to thank you again all for coming and talking with us today. I just want to again reiterate, that we understand and we're hearing more from several of the systems that there's concern about having additional funding with respect to the first tranche of money and when we're going to be delving into the second tranche of money. With that being said, we are making strides at this point to start looking into how we can start appropriating or allocating that second glug of money, for lack of a better word, as soon as possible. So I want to let you know that we are hearing your concerns. We are trying to address these concerns. I'm pleased with the staff's progress on getting agreements in place as quickly as they have. I feel confident that we will get through this all together. So not hearing any additional questions, I hope you all have a wonderful Wednesday and a great remainder of the rest of the week.